everyone, and welcome to today's session. My name is Selena Degano, and I'm a Senior Program Specialist in Comprehensive Tobacco Control at PHO, and I have the pleasure of moderating today's session. Before we get started, I'm just going to go through a few housekeeping items. So Zoom allows attendees the ability to customize your own view. You can do this on the right-hand corner of your own screen. We will be using the Q&A pod. If you have any questions during the session, please populate them in there. And at the end of the session, we'll be going through all the questions that have been submitted and do our best to answer as many as possible. And we just want to note that the chat pod has been disabled to limit any of the distractions during the presentation. There is one exception. During one of our polling questions, the chat pod will be open so that respondents can provide a little bit more detail to their answers. And if at any point during the session you experience any technical issues, please email events@oahpp.ca, and that email is also, you can find within the chat pod right now. So I'm going to move on to introducing our speakers for today. For today's presentation, Sharon Curtis and Dr. Pam Kaufman will be presenting. Sharon Curtis is a project manager at the Lung Health Foundation and is currently leading the development and delivery of the Quash program that we'll be discussing today. Sharon has over 10 years of experience working with youth and has a health sciences undergraduate degree from York University. And our other presenter is Dr. Pam Kaufman. She is an assistant professor at the Ontario Tobacco Research Unit and the Dalla Lana School of Public Health at the University of Toronto. For over 20 years, she has been conducting research on tobacco use and more recently on e-cigarette and cannabis use. Dr. Kaufman is also involved in the design and evaluation of policy, programs, and interventions, including smoking and vaping cessation programs for youth, young adults, and workplace-based smoking cessation initiatives. OTRU is collaborating with the Lung Health Foundation on the research and evaluation components of the Quash project. They conducted background research to inform program development. They are involved in the pilot beta testing of Quash and the facilitator training program and the overall evaluation of the full programs. So now I will pass it on to Sharon to get started on the presentation.
Hello, everyone. Welcome to the presentation today. Thank you, Selena, for that wonderful introduction. It is a pleasure to be presenting today. First, I'd like to start off and just say that Pam and I do not have any disclosures. And as Selena mentioned, my name is Sharon Curtis, and I'm working with the Lung Health Foundation as a project manager with a focus on youth engagement and knowledge translation. So today we're going to be talking about Quash, a behavioral approach to youth vaping and smoking cessation. I'll share a little bit about the Lung Health Foundation, and we'll move on to today's learning objectives after that. So the Lung Health Foundation is the leading health charity dedicated to improving lung health for Canadians. Okay, now that you know a little bit more about us, I'll move ahead to the objectives. So today I'll provide a quick snapshot of the current landscape, and we'll talk more about Quash in more detail. Okay, so before we jump into it, we'd like to get to know all of you a little better. So we're going to check in with a fun polling question, our first polling question, to see how everyone's doing today. Okay, great. Thanks, everyone. So we'd also like to get a sense with our second polling question, and we'd like to get a sense of what geographic area does your organization cover? And if it's not your organization, could be your colleagues or someone that you're working with. Okay, so we have like a quite diverse group today, which is great. Okay, so thanks so much everyone for answering those polling questions. We feel like we know you better already. And speaking of what we know smoking is a public health epidemic. The majority of adults who regularly are smoking, they started using tobacco before the age of 18. Vaping rates have increased dramatically over recent years. And in one Compass study, they increased 238% from 2014 to 2018 among students in grades 9 to 12 in Ontario. Research shows us that vaping is harmful. Although we know that more research is needed, more long-term data needs to be collected, we know that there's various reasons why vaping is harmful. There's also an association found between smoking and vaping, showing us that young people who vape have an increased risk of subsequent smoking and vice versa. Contrary to this risk, many young people perceive that vaping is less harmful than smoking, but we know that it's complex, it's not black and white, and there's really complex issues that we're facing with these points. What else do we know? So we know that many young people do want to quit, but they don't necessarily know where to get started or how to get started. So what prompted the development of Quash? So I'm going to get into what Quash is exactly shortly, but for now, I'm going to leave you on the edge of your seat, and I'm going to take you back to where it all began. So what prompted the development of Quash was really a lack of cessation programming for young Canadians that was evidence-based. Between 2014 to 2018, the Lung Health Foundation, previously OLA at the time, piloted the American Lung Association's Not on Tobacco program. And at the time, the Not on Tobacco program was one of the only programs for high school aged youth that had a well evidence-based, long-standing history of providing youth with the resources and supports that they needed to quit. So through the Lung Health Foundation implementing the NOT pilot program and evaluating it in Ontario, it was clear that the foundational elements of NOT could be modified and used as a promising framework for an online program. Further to this, an online program could address some of the gaps in cessation programming for youth. So thinking in terms of funding, accessibility, and customization for individual needs. Okay, so a little more about Quash. So it utilizes the stages of change as one of the key theoretical underpinnings driving behavior change. Other theories and key interventions are also used in Quash, but I won't cover them all today. There are 6 stages of change. So pre-contemplation, contemplation, preparation, action, maintenance, relapse. And there are some variations when you do look into the stages of change in terms of the interchangeable titles of each stage, but we'll stick with these today. So each stage indicates one's level of readiness to change their behavior. We know with the stages of change that individuals can move back and forth between the stages of change in either direction. So in addition to the Lung Health Foundation identifying the gaps in youth cessation programming, OTRU also completed an interesting literature review in 2015 that summarized like the top must-haves of smoking cessation programming for youth. So I'll touch on some of the points here that were captured there. So having appropriate and relevant youth content that engages youth. Presentation approach is important, accessibility, affordability, cost effectiveness in order to address reach and impact. Cognitive behavioral therapy, motivational interviewing strategies were also shown to be effective. In addition to those, we know that there was school-based interventions, physical activity-based interventions. Relevant to this, internet and mobile-based cessation interventions were all seen as promising in order to support youth in their progress to stop smoking. And also noted in that literature review was the effectiveness of established programs like the Not on Tobacco program. So all of this information led us to applying for funding. We received funding from Health Canada in 2019 to develop an online cessation intervention for youth based on the above considerations and all the points mentioned above. So in addition to smoking cessation, the rising appeal of vaping also made it clear that the program needed to include vaping, dual use, and broader nicotine addiction. Also, before developing Quash, the Ontario Tobacco Research Unit worked with the Lung Health Foundation in collaboration to conduct the following research. So youth surveys, youth interviews, adult surveys, adult interviews, an environmental scan and literature review. And basically we were looking at what the needs were for adults and youth. And then we were also able to collect this information and use it to develop the program. So we're going to get into the third polling question here. And I'd really be interested in knowing what are some of your pain points when it comes to implementing cessation programming with youth and young adults. So if you yourself aren't implementing the program, what about your colleagues, other organizations that you work with? What are some of the barriers, the challenges? We'd like to hear from you.
And if you select other, if you can use the chat pod to add a little bit more detail, and you can select more than one option.
Okay, great. We're going to show the results. So quite a wide range of responses here. So that's very interesting. And also interesting is that these were the pain points that came out of the results for our adult needs assessment. So also that being said, from the beginning, we recognized that the importance of collaboration with co-designing Quash with youth and adult stakeholders. So equally important was developing a program with youth for youth that had lived experience with substance use. So we have two advisory committees. We have our Youth Advisory Committee, our YAC, and they're comprised of youth across Ontario. They're passionate youth that are committed advocates, and they are supporting other young people to quit, reduce, and maintain their quit status. And the majority of our YAC members have all had experience smoking or vaping in the past. So that's important to note. In addition to this, our Adult Advisory Committee includes passionate healthcare professionals, including but not limited to public health workers, physicians, pharmacists, policy advisors, youth advisors, and researchers, spanning in terms of their expertise. So youth cessation, e-cigarettes, youth engagement, health promotion, and there's about 20 members that we have, and they span across Ontario, Grey Bruce, Sault Ste. Marie, Timmins, North Bay, Toronto, and our members include members from PHO, OTRU, CAMH, Sick Kids, and various public health units, to name a few. We meet regularly with our advisory members, and this collaborative approach of meeting with all our members allows us to gain important insights to keep enhancing the program over time. So we know it's not going to be a static program. We're going to keep improving it. Okay, so I'm going to move on and share a brief video from one of our dedicated Youth Advisory Committee members. So Ethan will be sharing a few words of wisdom about his experience.
My name's Ethan, I'm 20 years old, and I quit vaping 2 years ago to create more balance in my life. I was at a point where my vaping addiction was causing me mood swings left and right, and at the time, I had no idea why. I decided to stop vaping so I could figure out what was going on and why I was having all these mood swings. And little did I know that vaping was the cause. My advice to anyone that's trying to quit vaping is tell everyone. The hardest thing to do is to say no to people who don't know you quit. When I told everyone that I quit vaping, I felt twice more obligated to say no. And good luck on your journey.
So as you just heard, it can be quite challenging for young people to quit smoking or vaping. Myself and all of you folks, we were all teenagers once, a long time ago. And now, like, think back to when you were a teenager and you had mood swings, right? It's a normal part of being a teenager. But now imagine how hard it is to decipher between mood swings and dependency on vaping and withdrawal symptoms, right, as a young person. So with the increasing number of complexity and barriers that our youth are facing when it comes to quitting, it's never been more important to meet teens where they're at. So our program is free, online, multifaceted. Our primary audience is youth, 14 to 19, and our secondary audience is adults. So this is why we created Quash, an app that helps teens quit smoking, vaping, and both. So the app is online, self-directed, easy to use, and you can access the support whenever or wherever they want. So also mentioned above and earlier in the presentation that it's grounded in research and evidence-based cessation practices. So touching on quickly, a couple of the main overall goals of the program is we want to increase access, we want to reduce barriers to in-person smoking and vaping cessation programming, support people through their individual journey because it's different for everybody, and we want to support youth in achieving their behavior change objectives. So this could be reducing, quitting, and maintaining their quit status. So an important part of meeting teens where they're at is understanding that each person, like I mentioned, has different needs. So they have different learning styles, different levels of motivation. So while some people want to quit in a self-directed way, others need a bit more guidance and support to successfully quit. So that's why we created a guided, facilitator-led version of the quit program. So the training is available to facilitators to become trained and lead a group of youth through 7 in-person or online sessions to help them get started on their quit journey. So the lesson plans cover topics like goal setting, creating your quit plan, creating your toolkit, dealing with slips, staying smoke and vape free, and finally celebrating how far you've come, no matter how small or big your progress. So this is just the beginning of the journey, and we really want participants to feel comfortable enough to carry on with their quit journey using the app. And so that's why we've integrated the app and the guided version of the program. So through various activities that they'll do with the facilitator, it will involve the app, their homework will involve the app, sharing their progress will involve the app. And so there's really an integrated approach here. So like I mentioned, together, the self-directed program and the adult guided version make up the program. So to ensure teens all receive the same guided version of the program, we've created standardized training for our facilitators. The Lung Health Foundation recognizes the importance of this. So one of the issues, though, with standardized training, that it can be slow to kind of get it started. We didn't want facilitators waiting ages to sign up and receive the training and a certification. So that's why we created this self-directed e-module format for the training. It consists of 6 e-modules, and facilitators will receive a certification right away upon completion of the modules. So also similar to the self-directed version, we also care about this version being accessible to youth. That's why you all can sign up and get certified and deliver the program to youth as soon as you're certified. So vital to the success of Quash is connecting teens to it. So whether it be yourself or a parent or a friend or a teen themselves, people need somewhere to find out more. So we've created a website where individuals and allies can access a suite of resources regarding the program, research, and more. So if someone decides they want to give quitting a try, after they access these resources, they can take the leap and they can actually download the app right from the website. Okay, so for example, here's a resource you can provide to young people in your life, to your colleagues. And so I'm just going to share a quick video.
So you're doing this. You're ready to quit. You're committing. Awesome. But now what? Where do I even start? Are there tricks? How do I fight cravings? What happens if I get stressed? How do I quit? Well, the truth is, so many teens just like you are wondering the same thing. And we know that, so we created Quash. Because quitting isn't a one-size-fits-all experience. It's about becoming smoke or vape-free in a way that works for you. Use the tools that will keep you motivated. That's what Quash is all about. It's about taking control, setting realistic goals, and living your life smoke or vape-free. It's about quashing your cravings. Check in when you need to. Log your cravings whenever they creep up. Track how intense they are, how you are feeling, and what situation you're in. It's about seeing how far you've come, seeing your longest quit streak, how much money you've saved to boost and energize you. It's about understanding what you need, recognizing patterns and finding ways around them, and ultimately making healthier choices. We know you can do this. We know you want this. We want you to succeed, and we're so ready to do it with you. So let's do it. Time to get quashing.
Okay, so I love that video and I'm so excited about how far we've come with this. It has been a year in the making and a year and a half in the making, and we've spent a great deal of time working with subject matter experts and youth with lived experience in order to ensure intentional and inclusive design throughout. So in the app, youth can select a quit date, make a plan, identify barriers, identify supports, track their progress, track their cravings, etc. So the list goes on. And then they can also access the tools section of the app and learn how they can help, the tools can help them deal with their cravings, their withdrawal, and also they can learn about how to seek additional support from professionals, like professionals at LHF, like the lung health line professionals. So right now I'm going to hand it over to Pam to share more about our learnings and how this all came together.
Thanks, Sharon, and hello, everyone. In the next few slides, I'll provide a high-level overview of the key findings from our pilot testing of Quash and the pilot testing that we did with the adult facilitator training. Next slide, please. We collected qualitative data from a subsample of youth between 16 and 19 years old who pilot tested the beta version of Quash. The aim was really to learn about testers' perspectives and experiences with using Quash, including what they liked most, what they didn't like so much, and where improvements could be made. These findings were then fed back into the development process. Next. Overall, responses from the beta testers were very positive. They really liked the interactive format. They liked being able to easily access support, and they liked the linked videos. They also really appreciated the guidance to set realistic goals for quitting or cutting back. However, what stood out as being most useful to them was the progress tracking feature and the motivation and support that was provided through encouraging messages and earning badges. For example, sorry, I just want to make sure I'm on the right slide. Next slide, please. Thank you. For example, this participant said, when they were asked what they liked best, definitely the counter, like the ability to track how often I've held my strength for not smoking. I think even in the sense of bad habits, that's something valuable to people when they're trying to remove it from their life. And just knowing how long you've gone without it is something that will motivate you and kind of keep you invested in your progress. Next slide. And this participant said, I love those badges because I felt rewarded for quitting. It made me feel a bit better. And when I relapsed, instead of like, it didn't discourage me. It kept me on my feet. It gave me good inspirational message, asked me a few questions. People want to go for something they can be successful, and having little badges and little icons, as little as they are, they can mean so much to a person. Next. So there were several suggestions as well for how to improve Quash. And these included simplifying the registration experience by reducing some of the features and questions up front, improving function and navigation and layout, which is expected in a beta version, including notifications or reminders to use the app, more mini games to retain interest and overcome cravings, and including a visual portrayal of the tracking results. Including a buddy system for support was also mentioned, as well as widgets to track smoking and vaping without going back into the app. And providing support for quitting cannabis use was identified by a couple of people. Next. So moving on to the adult facilitator training, we collected survey and interview data from a sample of adults who pilot tested the training. And participants included a range of people, including healthcare providers who were working in respiratory or lung health, in clinical settings, professionals working in commercial tobacco control and smoking cessation, health promotion, as well as practitioners working with youth. Next. Overwhelmingly, the pilot testers told us that the most useful parts of the training were the practical, evidence-based information about adolescent development and how to engage young people in smoking or vaping cessation. They commented that the training fills in a gap in youth-focused cessation programs, and the facilitator guide and toolkit were found to be very comprehensive. The pilot testers really liked that the toolkit and facilitator guide could be adapted by facilitators once they became comfortable with the content. The online format and downloadable resources were also appreciated, and there were a couple of comments how they were particularly relevant given the limited ability to gather on site for training during COVID. Next slide, please. There were also some suggestions for improvement among the facilitator pilot testers. In terms of content, there were some requests for more information about vaping among youth. And while testers understood that the Quash program did not include NRT as part of its strategy, some participants did comment on the need for more practical information on how to use NRT with the young people. Some testers also wanted more support for developing action plans. There was also a suggestion to customize the training for learners with different levels of knowledge and different types of experience with delivering youth and vaping smoking and vaping cessation. Other comments included having more focus and information about the Quash program up front, more interactive activities, improved navigation, and more realistic timeframe estimates for completing the modules and facilitating the Quash program. So that's it for the pilot testing, and now I'm going to pass it back to Sharon to present some of the user experience findings.
Great. So as Pam mentioned, we also did some usability testing, and Hostile Sheep was the organization that we hired on to support us with this usability testing. So very high level, what's the purpose of usability testing? So we want to uncover problems in the design, discover opportunities to improve the design, and learn about users' behavior and their preferences. So I'll try to summarize some of the testing results from our UX experience with our end users. But of course, the report we received back from Hostile Sheep was over 100 pages long. So I'm going to give you the Coles Note version. So registration, originally we had quite a few screens that our end users and our individual testers had to go through until they reached their dashboard. So what we did is we made a lot of these screens skippable so that we wouldn't have as many people drop off before they even reached the dashboard and even got into the app. So that was one of the improvements that we made. Also, prompts were suggested as well. So prompting people to complete activities, complete their profile, if they weren't able to do it initially. So also asking users to track, log their cravings, and help them manage their cravings. So we have a whole cravings workflow that's actually in the latest version of the app. And we didn't even have a cravings workflow before at all. And so we're really excited about this latest feature. Also using an onboarding tutorial in the app to help introduce people to the app's features, and using card-based dashboard actions right on their dash so they can see them clearly and what's needed in terms of next steps and activities that they can engage in. Better integration of features. So we wanted to integrate and connect the dots between some of the features in the app. And one example of this was originally we didn't have we didn't have the tracking buttons, which allowed the user to track whether they were smoke-free or vape-free or not smoke-free or vape-free. We didn't have these buttons on the dashboard. They were actually located somewhere else in a calendar that was hidden in the app. So now those buttons are right on the dashboard, easy for the individual to see. And then basically all of these recommendations were implemented after the beta testing. So now that we've kind of gone over like how the program came to be, some of the key improvements, I'd like to talk about how you folks can get involved. So who can become a Quash facilitator? So we know caring allies play a key role in supporting youth on their journey to quit smoking and vaping, and adult facilitators with engagement strategies, they really make concepts come alive for young people. So our adult audience that we're looking for to become trained as Quash trainers are ideally adults that work with youth, perhaps ages 14 to 19, or young adults, if you will. And then also, especially adults that are working with youth who smoke or vape, or they're working in the field of substance use and addictions. Now, it's not limited to those adults. We really want to keep it open to a wide range of roles and designations that might find this kind of programming relevant and really useful in their communities. So it could be community youth workers, social workers, addiction counselors, nurses, teachers, First Nations youth workers, asthma educators, and the list goes on. So what are our facilitators going to learn from this training? So high level, I'll go through. They're really going to learn the skills and have the tools at their fingertips to effectively deliver the Quash program. And it's going to be over 7 sessions, but again, it's adaptable, it's a versatile program, and facilitators can change it up depending on the needs of their group. And another key piece of the training is providing evidence-based information on the health and psychosocial risks associated with smoking and vaping among youth. We also cover promising practices in smoking and vaping cessation using the stages of change, social cognitive theory, and other effective behavior change intervention strategies. So best practices in youth engagement and youth positive development are also covered, and practice strategies, facilitator toolkits, and all of these toolkits are included in the program, and they can be downloaded and shared very easily, and it's quite a robust, comprehensive program. Okay, so with the Quash program, we mentioned that you'll have, once you have the skills, we talk about how you can go about delivering the program. And I ideally recommend small groups of youth to deliver it to, but of course, in some cases, it can absolutely be delivered one-on-one. Some ideal locations for in-person delivery are school settings, community-based settings, or clinical settings, but you can also deliver it online, and we provide options and recommendations for that within the training. And of course, we want you all to know out there that Quash can be combined with NRT, counseling, school programs, and more. So I'm going to pass it over to Pam, and she's going to take you through what evaluation is going to look like coming up next.
Thanks, Sharon. So I'll briefly share our plans to evaluate the full versions of Quash and the facilitator training that were launched this week. The intention of the evaluation component isn't just to determine the effectiveness of the programs, but to also understand what's working, what isn't working, what could be enhanced over time. As Sharon said, these are not static programs. So the results will be used to provide feedback into the ongoing development process. Next, please. We'll collect qualitative and quantitative evaluation data from 16 to 19-year-olds who register for Quash between May 31st and September 30th of this year, and who agree to participate in our evaluation study. The data collection instruments will include 3 online surveys. There'll be a baseline survey upfront that will appear on participants' dashboard once they register for Quash. A follow-up survey will appear on their dashboard about 30 days after they register, and then there'll be a follow-up survey that will send 6 months after they register. We'll also conduct telephone interviews with a subsample of participants. Next, please. As someone very wise once told me, there are many ways to measure success, and we'll be measuring a wide range of evaluation outcomes. We'll be looking at changes in levels of knowledge and skills to support quit goals, access to social and physical supports that are needed to reach goals, reducing barriers to quitting, increasing motivation to quit, changes in patterns of smoking and vaping, including nicotine dependence, consumption, quit attempts, and sustained quits. We'll look at increased self-efficacy or confidence to quit and stay quit, improved self-reported general health, mental health, and stress, in experience and satisfaction with the program and the features. We'll also look at experiences with quitting. We'll ask people how they felt, what their perspectives were, how they actually experienced quitting. Next, please. We'll also collect evaluation data from adults who complete the facilitator training program. The data collection instruments will include an end of training survey and a 6-month follow-up survey. And we'll also be doing some semi-structured telephone interviews with a subsample of the training participants. Next slide, please. So the goal of the facilitator training evaluation is to identify gaps and to enhance the program further over time. So we'll use this end of program survey to find out whether the training results in increased knowledge and skills and intentions to use knowledge and skills to support youth to reduce their smoking or vaping or quit, access to social and physical supports to help youth who smoke or vape, increased motivation and self-efficacy, and whether trainees had a positive experience and satisfaction with the program and the materials. We'll also use the follow-up survey to find out whether the training actually reduced barriers for implementing youth smoking or vaping cessation, whether training participants used the knowledge and skills that they gained, and whether participants integrated Quash into cessation supports that they or their organizations offer to youth. So I'll now pass it back over to Sharon for wrap up.
Okay, thanks, Pam. So we've come a long way in the development of this program and training, but we still can't do it alone. We need your help to promote the app to youth and adult allies. We need you and your colleagues to sign up to become facilitators and spread the word about Quash. And we also have the website, of course, so that you can access it, and people can go on for themselves and see what different opportunities exist for them and other people in their lives. On the website, we also have campaign assets at the bottom of the screen. You can click on that button and you can download the social posts, you can download the posters, and you can share those. They're available to your disposal to share with your networks, on your social accounts. So what we're going to do next is we're going to find out how you can use Quash in your practice. We're going to open the polling question, our last polling question, and see what you would select as a next step. Could be more than one response that you have, but you can pick your top choice, and then in a couple seconds, we'll take a look at the results. Okay, let's take a look at the results. Amazing. Okay, so it seems like quite a few of you are going to go to the website and download the app as a starting point. And then we have some variation. And also 56% of you are going to be sharing the resources and tools via your networks. So that's great. So thank you so much, everybody. Okay, so we're going to head into our Q&A period.
All right, thank you so much, Sharon and Pam, for a great presentation. So yes, we are moving into the Q&A. So if you haven't had a chance and you want to ask some questions, feel free to go into the Q&A pod and populate your questions. We'll start going through them, and some of them that we can respond through text will appear in the chat pod. So we'll get started. I'm going to combine some of the questions to help with Pam and Sharon in responding. So the first one was around why the target age group was selected. So why not younger than 14 or over 20? So why were the age groups chosen?
Yeah, great question. So this was, and Pam, you can chime in at any time. This was selected kind of to mirror the age group that was targeted in the NOT program. And research was done because around this age group, because, you know, before a certain age of about 18 years old, you know, there's a tendency, research shows, that people become lifelong smokers. And we wanted to make sure that we had the age range starting younger so that we could interrupt with an intervention. So that wasn't the case. But we also wanted the age range to be wide enough so that we got, you know, younger teens and some young adults as well.
Okay, great. Thanks so much, Sharon. So I know you went over a little bit of the details in terms of who are the adults that would be taking the training and supporting young people. Are you looking at targeting specific groups, and or who would the ideal adults would want to take these types of facilitation training?
Yeah, so I can touch on that. So really, we want to keep it open in terms of our adult facilitators. So it could be, you know, a wide range of healthcare professionals, like I mentioned before. So we have, you know, social workers, public health workers, nurses, you know, a lot of the adults that we would normally target may be redeployed, you know. Of course, people's lives have been interrupted and their normal work routine has been interrupted by COVID. So we're really keeping it open. It could be a wide variety of adults, you know, youth outreach workers, you name it. So we want to keep it open and really provide the opportunity to not limit people to who can implement it. Of course, if they have the experience and some of the knowledge that we ideally want for our facilitator, that's the ideal scenario. But really, we want to keep it open and just flexible for people. And we would like to, you know, over time, collaborate with different communities and different organizations to see how the uptake of the guided version is going.
Okay, great. So the next question we're going to go to, there's some questions about we have people participating from outside of province. So the first question of that is there any Ontario specific resources or components of the app that would limit or not be available to those outside of province?
Great question. So the app is really available, like the program is Canada-wide. So the app is available to everyone in Canada-wide. It's in the App Store and the Play Store as of Monday, World No Tobacco Day. So no limitations there. In terms of the website, we have a resource section on our website, and it does have different resources, you know, mental health, NRT, so that people can learn more. We will want to, you know, add to that list and create a more full library of resources that are maybe a little bit more applicable to Canada-wide. So it might be a small library right now, but we plan to expand it. So there might be a little bit of limitation there, but with the rest of the programming, there isn't too much of a limitation, and it's available in English and French as well. The training is available in English right now, and then in about a week or so, it'll also be available in French. English and French of the app and the website are available right now.
Great. Okay, so the next question is going back to becoming a facilitator. So how someone can be involved becoming a facilitator, as well as is there any limitations if they're not currently working with youth?
Right. That's a great question. So in terms of the first step you can take to take the training, you just go onto the Quash website, so quashapp.com, click on the the adult ally page, and then there's a register button, so you can register there. And then it's really simple. You just go through the modules at your own pace. So that's how you get started with the training. In terms of maybe a lack of experience, not working with youth previously, I would recommend, you know, partnering or collaborating with, you know, another adult ally in your life who has that experience. That's what my recommendation would be. But of course, you're not limited to that. If you feel like you have the skills and experience and you could take this on, I definitely highly recommend to go for it. But again, you know, draw on the resources within your community, and where you feel like you lack an experience, leverage that from someone else.
Okay, great. So going into the next question will be around stages of change in youth. And which stages of change do we think that the Quash program will most impact in terms of youth?
Yeah, so really we're looking at young people who are ready to quit. They've thought about it, they've considered it, and they're interested. So if they go on the website, they might be a little bit hesitant. They might be in pre-contemplative or the contemplative stage when they're looking at the website. And we're hoping that that website, the Quash website, is going to bump them into the action phase based on the information and the resources they see on the website, the benefits of quitting. It's going to bump them into that, preparation phase. And that's when they would download the app. So that preparation phase is downloading the app.
Okay, so the next question is around different communities. So they were wondering, is there a way that this program could be made culturally appropriate for First Nations, Métis, or Inuit youth? The person who posted the question could see that there's some interest and potential for First Nations facilitators, and that this individual currently works with a lot of these communities and these youth groups. So they didn't want to share it without understanding if there is any potential to kind of tailor it for this particular group.
Yes, great question. We have a couple of our adult advisory committee members that are from Tobacco Wise, and so they work specifically with Indigenous populations. What they've said from their perspective is that they'd love to take the parts that they can adapt and make culturally relevant to their communities. Is the program right now specifically for Indigenous populations? I would say no, just because it is like a wide-ranging program. It was a little bit challenging to kind of meet the needs of all the different special populations that have specific needs, but we're very open to refining it, enhancing it, potentially having a different version of it going forward that would be specific to the needs of Indigenous populations. So we're very interested in a collaboration like that, and any improvements and even a different version in the future for sure. So you can reach out to us and we'd be happy to see how we can work with your communities, listen to what the needs are, and adapt the program accordingly.
Great, thanks so much, Sharon. So we did talk about the target age group for the Quash program. Are there any other, I guess, resources that would be available for those that don't fall within that age group? So those that are older, is there anything from the Lung Health Foundation or that people could access, for example?
Yeah, I'll also let Pam speak to the older age group because OTRU has some exciting programs coming up as well. First, I just wanted to say in terms of the age group, technically, it's accessible for everyone. So that is our target. But of course, if you are outside of 14 to 19, you can use the app, you can use our programs and resources. So don't feel like that's holding you back. I'll let Pam speak to OTRU's programming that's coming up, and then we can absolutely share a couple other resources.
Thanks, Sharon. Yeah, so OTRU, the Ontario Tobacco Research Unit, also received some funding from Health Canada, and they've been, you may be familiar with Crush the Crave, which was an app that was developed by Bruce Baskerville and his team a while back. And so with this new funding, OTRU is, with its partners, are developing a vaping cessation app based on the Crush the Crave app. So it's an adaptation and will be focused on vaping cessation. So you'll hear more about that shortly. It's not out yet, but you'll hear about it shortly. There's also two applets that we've been working on. One is called Postcards from the Future, and one is called the Stop Vaping Challenge. So you'll also be hearing more about that soon, but I just wanted to put that out there, and yeah, you can keep your eye on what's coming down the pike with those.
All right, great. Thanks so much, Sharon and Pam. So the next question I'm going to ask is around what does success look like? So like, I guess the immediate and then potential long-term that you're looking for.
Yeah, I'll let Pam speak to this too, but you know, long-term, big picture, down the line success looks like, you know, young people feel as though that they've had access to evidence-based cessation supports, and they're achieving their behavior change objectives, and they're quitting, they're reducing, and they're maintaining their quit status. So we have an increased number of youth Canada-wide who are able to access, and we're seeing a reduction in terms of smoking and vaping rates. And then in the short term, it's really about, you know, improving knowledge, enhancing their skills, and then, you know, longer term, it's that behavior change piece for sure. But Pam, if you want to jump in and talk about any of our outcomes or objectives.
Yeah, I mean, you covered it well, Sharon. I think I would add that it can take many times to quit, and it's a long process for some people. And I think what this app does is encourages that that motivation to continue trying, and not to feel bad if you have a slip or you relapse. So we'll be looking at, you know, in addition to, you know, the number of quits people have made, we'll be looking at how long they've quit, on when they do quit. We'll be looking at quit attempts, changes in their motivations to quit. So those are all included in what we see as being part of that success and those long-term goals. Just keeping that going and continuing. And again, I think Sharon has mentioned earlier that this is also, the whole development process is ongoing. So finding out what's working well and what could be enhanced over time is also an important part of that evaluation in the short and medium term.
Yeah, I wanted to add one more thing. Pam, thanks for adding to that. But we just also, big picture, we want to provide that self-efficacy and capacity building piece with youth. And so really they feel like, okay, their confidence has improved and they have more control over their life. They have more skills and really like they just that improved capacity and self-efficacy. So that's a huge measure of success for us as well.
Great. Thank you so much, Pam and Sharon, for answering all of today's questions. Those are all the ones that came in. So hopefully we provided the answers that you were looking for. As we wrap up today's session, I'd like to send a huge thank you to Sharon and Pam for presenting, and of course our events team for all their behind the scenes support. I would like to also thank everyone for joining us, all our participants today. It was great seeing such a strong virtual participation in such a challenging time while working in public health and healthcare right now. And lastly, I have to let you know that you'll be expecting to receive a brief anonymous survey for today's session. And we really ask if you could please take a few moments to help complete it, and it helps with our programming. And there's also an opportunity to put any suggestions on other topics that you're looking for. So all of that is really important. So if you can take a few minutes to fill out. And on behalf of the presenters, myself and the events team, thank you so much. And I wish you all a wonderful day.